The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, it's Dr. Rudy Kachmann. Welcome to our show. I even have a great guest with us today, and the name of the show is going to be Health and Wellness by Weight Management. And I brought an expert aboard here, Dr. Mahtab Ahmed, a American board certified in obesity medicine, overweight medicine. He's also a family doctor. But tell us, Dr. Ahmed, tell us about yourself a little bit. What are you doing now? Where are you working? You know, things like that.
Okay, I'm actually a family doctor. I work for Activate Healthcare in Van Wert, Ohio. And I utilize the family medicine as well as obesity medicine expertise to help people lose weight and get healthy. And reduce the risk of heart disease.
Yeah, and all the complications that occur from being overweight, which a lot of us got a problem with. Let's face it. My dad had a deli in New York, so you think I always was of normal weight? No, but I learned better. And we're sort of working together at the Three Rivers Pharmacy, where I saw 4 people today. And he's passionate about this also because so many diseases and illnesses attached to being overweight, and they can be prevented and they can be stopped. So we're going to discuss this subject in some detail today. Tell me this, how do you assess a patient? You know, you're seeing a patient, even say in Ohio or at the Three Rivers Clinic. How do you what studies do you run to find out how they're doing?
Okay. Obesity, although we think that is due to excess body weight, is actually defined by excess body fat. So when some people has excess body fat, some of the fat may get sick. We call it sick fat disease. And just because of sheer amount of fat, there will be some fat mass disease. So sick fat disease, those fat cells will secrete a lot of chemicals, and that lead to pre-diabetes, diabetes, high blood pressure, cholesterol problem, heart disease with time. And fat mass disease will lead to reflux and arthritis, obstructive sleep apnea. So when in the office, when you're evaluating a patient who has obesity, goal would be check the body weight. And then we need to look at the waist circumference. That is the standard. There is a criteria for that. And waist circumference can be also explained with other parameters. In a woman, if we have a hip circumference, and if the waist is larger than the hip, chance of metabolic disease or sick fat disease in the tummy is high.
I see.
On the other hand, in a man, if the chest circumference is less than the waist circumference, their risk of excess fat in the tummy and metabolic disease is higher. So by doing those simple weight and circumference measurement, you can get some idea what kind of metabolic problem they may have. And then if we have a machine called fat percent body measurement machine, you can also measure the fat, and you can figure out if they have more than 25% in a man or 32% in a female, they could be classified as obese.
Yeah, it's done by electrical impedance or something.
Exactly.
And there's a
Right.
machine that
does
you
it.
can use. You see him at health fairs now and then.
Yes.
And he's speaking about the hip measurements, belly measurement, chest measurements. And I've always thought, is this correct? That I can always, with my eyes, almost tell if you have a bunch of belly fat, odds are of you being pre-diabetic or diabetic is pretty high, isn't it?
Extremely high, yes.
That's almost as good as a blood test.
Exactly.
Yeah.
Sometimes it is.
In fact, I've always said and read that if you've got a belly fat, you're probably pre-diabetic. Would I be right most of the time?
Good possibility.
Good
And
possibility. Yeah.
Then we should look at their blood work.
The blood work.
Yeah.
Yeah.
So if we say, do we need expensive blood work? No. We
No.
just need a fasting blood glucose. And then if the blood glucose is more than 100 and 125, we
Yeah.
call them pre-diabetic.
Yeah.
If it is more than 125, we'll call them diabetes.
Gotcha.
So now, if somebody has a waist circumference large and their fasting blood glucose is normal, that means less than 100,
Yeah.
we are going to challenge them with 75 gram of sugar,
Yeah.
and then 2 hours after, we're going to check the sugar level.
Mm-hmm.
By that criteria, also you can catch those people who are not really pre-diabetic, but possibly is with that test.
Even before pre-diabetes. I
Right.
mean, now you're really screening people, which I highly recommend to catch them
Exactly.
very early because
Right.
they don't have to lose much weight to avoid.
It's preventable disease. So
Yeah.
earlier we catch, we can handle this.
Yeah.
Another test will be A1C.
Mm-hmm.
That also, if it is less than 5.7, we're going
Yeah.
to consider normal.
Uh-huh.
5.7 to 6.5, we're going to say pre-diabetes. 6.5 or higher, we're going to say diabetes.
Yeah.
Now, even those tests, if we suspect that this person has metabolic syndrome or problem with insulin, we are going to do fasting insulin, and 2 hours after that 75 gram of sugar insulin level. And you'll be amazed if you give that. If somebody is insulin resistant, they're going to build a lot of insulin compared to the person who is not insulin resistant.
Yeah,
so
in
that's
other
a
words,
very good test.
Yeah, and I emphasize that too, because the blood sugar may be normal,
Yes.
but the serum insulin is elevated because it's insulin's job to bring sugar into the cell for energy.
Yes.
If those receptors on your cells are full of triglycerides, you have insulin resistance.
Yep.
Again, what we are interested in is diagnosing people very early, catch them early in pre-diabetes, or even before, to avoid a lot of trouble. Let's discuss a minute. We say, why lose weight? What are we avoiding? And how many illnesses do you think are related to metabolic syndrome or elevated triglycerides or too lower HDL or abnormal belly measurement or hypertension, which is an early thing? How many illnesses do you think having excess weight causes?
Good question. We can kind of classify in a group. So metabolic complication because of high insulin level or insulin resistance can lead to prediabetes, diabetes, hyperlipidemia, increased triglyceride, decreased HDL, and LDL, that bad cholesterol may go up and increased risk of heart disease.
Yeah.
So those are metabolic complications.
Yeah.
Then it can lead to some problem with inflammation in the artery wall, and it increased risk of heart attack. So obesity, although we are thinking about fat tissue, but it's actually an inflammatory reaction in the whole system. And then another complication could be that just too much fat, that will lead to the reflux disease, arthritis, and obstructive sleep apnea type of disease. Venous stasis, even venous stasis also can lead from the obesity. Now, another complication would be when there is inflammatory reaction in the sick fat, it also affects the hormones, estrogen.
Yeah.
So what we find out that people who has that abnormality in the hormone because of obesity, they will have increased risk of cancer. So the gynecological cancer, renal cancers have higher risk because of obesity. So these are
I've heard that like uterine cancer, 75% is related to being overweight.
Yes.
75.
Right.
And then ovarian and breast cancer, maybe 50%. All avoidable if you get to a normal weight. Isn't that interesting?
Mere 10% weight loss
Yeah.
can do a significant reduction of the risk of this.
Yeah.
One other thing I see very commonly called polycystic ovarian disease is actually related with insulin resistance. And that's very common. And
polycystic ovarian disease. So all those female cancers, breast cancer, ovarian cancer, are related to the weight.
The last group that a lot of time we forget, that will be depression, anxiety, eating disorder, could be related with obesity.
Yeah.
That's psychological effect of it. And the social effect is tremendous. You know, we still have that idea that is a problem with behavior, which is an absolute idea. That idea should be gone because we know about this disease. American Medical Association recognized this obesity as a disease in 2013. So the impact of obesity starts actually at home, school, work, social, different places. They get bias everywhere. So these people with obesity has difficult to deal with all these in addition to the metabolic conditions.
A lot of depression, and the kids are making fun of the kids who got pot bellies, and that is psychological effects. In fact, if you see a teenage kid with a pot belly, you think probably he's pre-diabetic, huh?
Yes.
Yeah. The other thing I want to mention too in these complications, which is probably 50 diseases or so, or maybe even more.
Close to 70.
And close to 70.
Yes.
Yeah, I noticed that in your PowerPoint. Most causes of memory loss, they might call it Alzheimer's disease. Actually, I find out after extensive reading, I'm giving a talk on Tuesday at Lutheran Auditorium on memory, is that insulin resistance affects the proteins in our brain and is the biggest cause, frankly, of dementia and memory loss. Avoidable.
Yes.
I mean, that's a wonderful opportunity. You know, Eli Lilly's doing research, and they just admitted they'd spend $1 billion. Didn't come up. They're looking for one drug. One drug isn't going to do it. It's proper eating and lifestyle, and whether you exercise or not, they can get rid of most dementia. Isn't that wonderful?
That'll be great.
You know, that smells an opportunity. And I guess they call it a disease now. Being avoided is a disease. It's a judgment-free zone. You know, the Japanese didn't like the word obesity or weight, so they call them metabos. Yeah, I read that. Isn't that interesting? Yeah. I wouldn't mind doing that because it's a disease. Nothing to be ashamed of. Like we all like to eat. Man, there was a donut at night at home when I come home today, I'll be eating it. And so don't think that's anything unusual. And you know, and we talk about and weight loss is what we're trying to achieve in the easiest manner. They speak about that we have a set point. Our body tries to keep us at a certain weight. What's your interpretation of a set point?
Okay. The set point for energy metabolism was coined first time by Dr. George Blackburn, who we considered father of obesity medicine from Harvard. He died the last year, but he brought up some ideas, and he's the one first started the residency program for obesity medicine in our country many years ago. So his idea is that there is a set point in our brain that how much I'm going to eat and how much I'm going to burn. And that will lead to how much fat I'm going to store in my body. So if I am born with a set point right at the middle, no matter what I do, no matter how much I eat, if I don't do exercise, still I'll not gain weight. And that's not my credit. I was born with that. On the other hand, there are certain people, if I elevate the set point, for example, I got pregnant, or doctor gave insulin, or an antidepressant, or I had a surgery, I could not move, or I start to work third shift, I did not have good sleep, the set point will go up, and we are going to gain weight. And this sensitivity to different people is different. So on the other hand, if we can reduce the set point with different intervention in a specific individual, you will find out that you'll lose weight. So it could be simple as eating right, doing exercise. It also could be a antidepressant that your doctor started, make you feel good, but you gain weight. Once you take them off, your set point will go down and you may lose weight. So that's the concept of set point.
Yeah, and it's very important because a set point can change.
Right.
You put people on starvation diet and the body remembers through evolution to keep you alive, and they'll drop the set point, but now you're not burning as many calories because your set point is stopped and you start gaining weight. Discuss with us a little bit the hormones that are involved because our appetite and is determined a lot by the hormones in our body and our stomach and our small intestines. Can you kind of give us an overview a little bit?
I really thank you for asking me, because obesity is actually neuroendocrine disorder. So for regular people, I'm going to say the brain is involved and a lot of hormone involved.
Yeah.
The most common hormone is insulin. It's like a mother of hormone. It can do a lot of things. You already know that it controls your sugar, but it has tremendous effect on the growth of a little baby. So when the baby is growing, and they need a lot of insulin, and insulin is a growth hormone. So after about age 25, if I continue to eat a lot of carbohydrate, which will lead to high insulin level, and insulin, there is no room to grow. So what will happen? You are going to grow in the tummy area, not vertically, but sidewise.
Yeah, I've heard insulin is an anabolic hormone.
Yes.
It makes you gain weight.
Right.
And but some people it saves their lives too.
Right.
Please continue. Yeah.
So what I'm going to say, if somebody says, Doc, when should we start doing good diet? After you're grown, you really should not eat too much carbohydrate. Then you're making a lot of insulin, and then you're going to grow here.
You're going to grow there.
Right.
Yeah.
So that is one. Insulin, what it does, it takes the sugar out of the blood in 2 hours and keep the blood sugar normal and saves our life.
Yeah.
Our body cannot tolerate high blood sugar. You already know that. Because once the blood sugar goes up, we call it glucotoxicity.
Yeah.
It's a toxic. So the insulin job is to get the sugar out of the blood in 2 hours, keep the blood sugar normal, as well as insulin stop the fat burning. It doesn't let you use the fat as a fuel. Fat is sitting there. God gave us fat for a rainy day. We are supposed to use it. What insulin will do, take the excess sugar and it store them as fat, which is called triglyceride. And it goes on years and years and years. So we never use that fat as a fuel because of high insulin. So that is the one hormone has tremendous effect on metabolism. A couple of other hormones that is really important is a ghrelin. It comes from the stomach. So if you're hungry, stomach will make ghrelin. So more ghrelin, more hunger, more eating, we gain weight.
Yeah.
So once I start eating, because the ghrelin is up, and once I start eating, then there is another hormone called GLP-1 comes from the duodenum area, and that will tell the brain to stop eating. So that hormone actually cut down the appetite and help you to lose weight. These two hormones not only working with the brain, it actually affects your metabolism and amount of fat you're going to have. There are many, many other hormones involved in the brain. There are two groups. One is called anorexigenic, means you'll eat less, and there is another group called orexogenic in hypothalamus in the brain, will regulate how much you're going to eat and how much you're going to not eat. And those centers, those hormones will affect appetite, intake, as well as fat.
Okay. Yeah, thank you for the explanation. So
I forgot one other hormone.
Yeah,
Doc.
go ahead.
Leptin. We talked about that.
yeah, that's
Remember?
a big one. That's a big one.
What I think is that brain regulates amount of fat. Brain doesn't care about our body weight.
Yeah.
Brain will regulate the fat as if it's like a gas tank or like a bank balance. By evolution, brain does not want to lose those. There was famine, there was no food, and therefore brain has a mechanism to keep the fat there all the time, as much as possible. If I have fat, fat will secrete a hormone called leptin.
Yeah.
Leptin will tell the brain that how much fat I have for long term.
Yeah.
If somebody is born with no leptin,
Yeah.
they are going to be 700 pounds, 600 pounds. So we can do a test.
I saw some in the hospital, 600, 700 pounds. They can't.
Right.
Eating makes no difference. It's just the way it is.
Right.
Yeah.
So because if they don't have leptin, brain thinks these people are fasting.
Yeah.
Because the signal doesn't go there.
Yeah.
So that's the reason what will happen if we find one, if we give a leptin injection, they don't have to do exercise. They'll lose weight.
Very interesting.
In a regular patient, if we check leptin level, we see that they have high leptin.
Yeah.
So why? We think that leptin is supposed to tell the brain that how much fat I have. These people have something called leptin resistance. It's kind of like insulin resistance.
Yeah.
So brain, although there is leptin level in the blood, brain doesn't recognize it. Brain thinks that these people are fasting.
I see.
So they will increase their intake and continue to have more fat.
And things actually get worse, huh?
Right.
Generally, for what I teach, I don't use a lot of medication. Do you use a lot of medication in trying to get people's weight under control, or do you use it occasionally?
Okay, that's a very good question. I think the medication is important part of weight management. Why? Obesity is different for different people. Some people may have deficiency in their genetic background. Some people may have pre-diabetes, diabetes. Some people may have behavioral problem. Some people eat wrong kind of food. Some people do not do exercise. So all these people, they're different group.
Yeah.
You can't just fit in exercise. So in some people, they may have, we call it binge eating disorder. They just can't stop. They don't eat because they're hungry. They just eat.
Yeah.
And some people are stressed, they will eat. So my number one approach about medication for weight loss is depending on what the problem is. So if somebody is pre-diabetic or diabetic, the best medicine for weight loss is going to be metformin. It will give you 5% weight loss. It will treat that insulin resistance problem. On the other hand, if somebody have eating disorder or binge eating disorder, if they don't have any heart disease or problem like that, that individual will be good for those FDA approved weight loss medicine which works in the brain and cut down the appetite. So I got to pick those people according to their history like that. So another medicine called Topamax. Topamax is a medicine for headache. It actually causes taste aversion. So for example, somebody likes chocolate, and if we give them Topamax, the same chocolate will not taste right. They will develop taste for broccoli that they didn't like before. So we use that to help them to stay away from those high risk food. So I have a study in my office about 77 people. Out of those, 70% were on metformin, 40% had eating disorder, so they were on phentermine, which is a FDA approved weight loss medicine, about 46% patients were on Topamax. Now, FDA have a lot of medicine for weight loss, but it's pretty expensive and insurance does not pay for it. So my group could not afford it. Then 3 medicine that I told, those are affordable medicine, and they had taken and they were successful in weight loss and maintenance.
Yeah. What percent of the people that you're treating generally on weight loss medication?
Okay. In our country, 2 out of 3 people has either overweight or obesity. So let's go back. How do we define obesity with BMI?
Yeah.
If somebody's BMI more than 30, we say this is obesity. If somebody's BMI is between 25 to 29.9, we're going to call it overweight.
Gotcha.
And then you're going to do the waist circumference, and you check a little blood pressure, check a little sugar, and lipid profile. So if somebody have 3 out of those 3 problems, like weight, waist circumference, or maybe a little borderline sugar, or maybe a little borderline high blood pressure, if you have 3 of them, we call it metabolic syndrome. So I'm going to say about 65% of my patient group has same thing as our United States data, that they have metabolic syndrome. And those are the people I'm going to try hard to prevent the weight gain or become diabetic, because diabetes is preventable.
And you would probably maybe not use medication on them? Or
I'll use actually everything. Behavioral modification,
Yeah.
nutrition,
Yeah.
as well as medicine.
Yeah.
Most of these people went to a traditional physician, nothing wrong with them. They're trained to give them
Yeah.
pills.
Yeah.
They're trained to give them a little sheet, which I used to do a long time ago. My goal would be not throwing the pill first. First of all, teach them what insulin resistant is and see if we can change their behavior. See if we can get them off that pop that they drink or fast food restaurant that too much goes. Those are the big factors in there. So if I can change that, if they show that they're interested in it, then I'm going to add a little bit medicine if needed.
Yeah, I love that approach. Let me tell you a bit about what I've been teaching. Okay, now I'm not certified in the obesity thing, but I'm a wellness doctor, and but I really agree with the way you approach it. And I want to compliment you because, in actuality, Ahmed, you're a family doctor, and there's so much of this overweight and obesity problem, or metabolism, whatever you want to call them, in this country and in the world. You're really demonstrating that, frankly, every family doctor should be certified in this, because we will never have enough obesity doctors or metabolic doctors, whatever you want to call them, to solve this problem. This needs to be attacked. The medical schools need to promote this and maybe even include it part of the standard course.
Yes.
Don't you think it should be part of the standard course? It is so prevalent. And let's face it, I've been demonstrating and aware of this, but you are practicing it. And as a family doctor, you see at the Cooper Farms, you see these 2,000 employees, and you're managing their total health. When you think about it, how lucky they are, because every one of the people you see there, you teach this to. And would you agree? I think every family doctor should be certified in this method of teaching. But I tell you what I've been teaching is Dr. Furman, Dr. Esseltine, Dr. Mark Hyman, which is not a lot different. Well, we're teaching really eating 70–80% nutrient-dense food full of vitamins and minerals, vegetables and fruit, and maybe 20% organic meat. Exercise a half hour, 60 minutes a day. It's not hard. It is really not hard. That's what we teach, and you wouldn't argue with that. And for the cases where it's just out of hand, which a lot of the biggest weight gain, I guess, has been in the 200 to 300 pound group anymore. Obviously, I would think a significant number of them would require medication. which I wouldn't argue with at all. So I think we work well together. You know what I mean? One can just do it on coaching and wellness. If it doesn't work, then we add some medication and follow them. And reading your paper here, your dream is to learn to manage these people, see them, evaluate them, and then maybe go to Skyping or some method through the internet and coach them online so they don't have to drive miles and miles because you're so rare to find. But I think it's a wonderful dream. Another way I teach it, which I think you do too when reading your PowerPoint you provided for me, is when this is your calorie burn, say, for the day, half of that is your basic metabolic rate. How do you look at the basic metabolic rate? The activity of your brain, your heart, and lungs at rest, the calories they burn.
Yep.
Hard to change that, isn't it?
No, that's regulated. Brain regulates.
That's regulated by your brain and your body.
Right.
And then you spoke about thermic effect of food. And then John Levine wrote a book on this years ago for the Mayo Clinic. And then he calls it non-NEAT, non-exercise activity thermogenics. I made up a name for that, and I wrote a book on it after that. I called it activity living, AOL. It's a little easier to pronounce. and if you can increase your activity of living, like standing up, for example, when you're on the phone or parking your car far away or getting a treadmill desk or a stand-up desk, when you stand up, you triple your calorie burn.
Yes.
So if you can do this at work, for example, increase your calorie burn 200 calories a day. You know what that is? 20 pounds in a year. Yeah. So is what we're speaking about difficult or impossible? I don't think so. Tell me one other thing you discussed, which interests me a lot. We should increase our protein intake a bit, right? Because it does increase the blood sugar. And you speak about ketosis. And I was reading that if you say don't eat from 7 p.m. to say 9 p.m. or so, you've gone through 12, 14 hours, and you can kind of go into ketone metabolism, can't you? Explain to us, what is ketone metabolism?
Wonderful. So I'm going to talk just like I'm talking with the patient, not with the dog. Okay. So our body is like a hybrid car. Body uses the fat as a fuel and carbohydrate as fuel. These are the two fuels we use. Every time I eat carbohydrate, it becomes sugar. So it really doesn't matter what carbohydrate. It could be a donut, it could be a potato, it could be banana. All are carbohydrate. So try to make it simple. Everything becomes sugar in the blood.
Yeah.
And once the sugar goes in the blood,
Yeah.
body goes in 911 mode because body doesn't like high blood sugar.
Yeah.
It makes insulin. Insulin comes out, take out the sugar, keep the blood sugar normal. Insulin also keep the excess sugar as a fat. Now, if you start burning the fat, you lose weight. God gave you fat, it's sitting there to be used. So when I'm asking my patient lose weight, I'm actually asking them to burn that fat. Now
That's
remember,
the main arrow is pointing
yes,
at the fat.
burn that fat. So many years ago, more than 30 years ago, somebody said that if you eat fat, you are going to be fat. It's actually probably not true, because if you believe that insulin causing the accumulation
Yeah.
of the fat, it's
Yeah.
actually the sugary food causing it. Anyway, so if I believe that insulin takes the sugar and store them as a fat, if I lower the insulin level, what body will do is start burning the fat. So how do you lower the insulin? We already know that if you eat carbohydrate, high insulin. Low carbohydrate, low insulin. So what I do, my patient will count carbohydrate, total carbohydrate, every single day for 2 weeks. And they will check their body weight every day. So after a couple of weeks, they figure it out that how much carbohydrate they make them lose weight. And that means they're burning fat. So invariably, I'll find out that patient, when they're eating 60 gram of carbohydrate every day, they go in fat burning mode. And that's the doc says ketosis. That's called nutritional ketosis actually. There's nothing wrong with that, because when you're sleeping 10, 12 hours, bodies actually have no fuel. You're using that fat as a fuel.
While you're sleeping, huh?
Yes.
Yeah, huh?
So it is a normal process. Now, if you are diabetic, type 1, don't do those. Those are for people who has obesity and doesn't take any prescription medicine.
Yeah.
So what I'm going to say, if you lower the carbohydrate, you're lowering the insulin, body will start burning the fat. And that's called nutritional ketosis. Now, 60 gram of carbohydrate is actually 4 pieces of bread. Nobody can do it. It's impossible. So then comes the protein. So if I eat protein, there are 3 functions of protein. You already know that protein protects your muscle. That's number 1. Number 2, what it does is cut down the appetite. So you can do that low carbohydrate diet and burn the fat. Number 3 is the most important one. You need about 20 to 30 gram of protein to start something called lipolysis, which is it goes to the cell in the mitochondria, it will start the fat burning. So if I eat a low carbohydrate diet and if I eat 30 gram of protein 3 times a day, every time I'm eating that protein, you're going to get 3 hours of fat burning. So if you can do that whole day, 9 hours of fat burning you'll get. So that's the important part. You may say, how do I know 20, 30 gram of protein? I didn't know that. So what I do is tell my patient that if you have 1 palm, if it's a smaller palm, it will be 20 gram. And if it's a larger palm, it will be 30 gram. If you put 1 egg, it will be 6 gram. 2 egg, 12 gram. If you have a little sausage, you barely made it to 30 gram. So some people will ask me, what about a piece of meat? Yeah, a piece of meat will be fine, but it has to be thick enough. So turkey, chicken, that will be minimum amount of protein that you need every meal. Many times it's the rest of your life. Now, protein is important for your health. Not only your fat burning, your overall health for your muscle.
I see. Very, very interesting. Suppose I have some bacon with the eggs. That's okay, right?
I think it will be fine as long as you are doing low carbohydrate diet.
Yeah.
Because if you are eating a high carbohydrate diet, you are going to bring insulin in. Then excess fat will store as a fat. Then
you'll be
burning
stored as a fat. What are other good protein foods? If you get an overweight person, what kind of protein would you suggest they be eating? Anything?
Most of my patients are very happy with meat and eggs, but they cannot do it long term. My program that I start off with 12 weeks. After that, we can change a little bit. So I have few patients, very few are vegetarian. So that becomes a little difficult. For them, I'm going to say tofu is one of the good protein.
Tofu.
Yes.
Yeah.
And if they can eat fish, that would be okay also. Eggs will be okay if they can eat. And I started to use actually protein shake, understanding that they can't eat the regular protein.
I recommend to a lot of people because what's something simple they could do? Have a smoothie every day. Take out because a smoothie, the Vitamix machine or Ninja machine, whatever, breaks up the cellular structure, releases a lot of vitamins, minerals, and phytochemicals that feed your nutrient need, help turn your appetite down. And I found patients their blood sugars are pretty regulated, the appetite. Like I take one every day. I had one today. I won't be hungry till 4 or 5 o'clock. Even lunch gets a little borderline for me. Although we recommend 3 meals a day, don't we?
Right. Yep.
And generally 3 meals a day.
If I can add one little thing.
Yeah.
About the plant protein.
Yeah.
You know, and the plant protein like beans has protein in it, right? First 12 weeks, I'm going to be really careful about protein,
Yeah.
if I can, because
Yeah.
plant protein always has a little bit carbohydrate hooked up with that.
Yeah.
So if it's possible, first 12 weeks, we may not able to avoid that plant
Yeah.
protein. Plant protein also is not a complete protein. It lacks some amino acid.
Yeah.
So in that sense also, it is very difficult to get enough leucine, which is amino acid really
Yeah.
important for fat burning.
Yeah.
It's difficult. So for patients who wants to use the plant protein, they really need to have smaller amount because of the carbohydrate content. After 12 weeks, you can reintroduce some of the plant protein.
Yeah. I mean, Dr. Furman, Dr. Esseltine, and they will say, eat all you want of vegetables and fruit. And I follow that, and I find people really lose weight quickly and maintain that, and to take a little vitamin D and a little vitamin here and there, I think is important. What about the amount of weight loss that people have to get rid of diabetes or get rid of metabolic disease? What % of the body weight will they have to lose?
Wonderful question. We have long-term study that 3 to 5% weight loss helps to prevent diabetes. Remember the 3 to 5%.
Wow, 3 to 5%. Isn't that
Right.
wonderful news?
Yes.
Yeah, that is not huge.
Right.
Yeah.
And 10% weight loss. So think about it. If somebody is 200 pound,
Yeah.
only 20 pound
Yeah.
weight loss can definitely help in diabetes and heart disease and cholesterol, all sorts of metabolic disease. So we usually start off with program that 12 weeks, 10%. That's our goal. And then after that, they reach that goal, then we make another goal depending on how much they want. But 10% weight loss is kind of like industry standard now.
Yeah, isn't that wonderful? I mean, that's really great news. Really great news.
Right.
That we don't have to lose a third of our body weight to get rid
Exactly.
of our potential for 70 illnesses.
Yes.
I mean, that makes it a lot easier. And if they increase the activity of living, say at work, walk a little bit, take the dog for a walk, or develop some habits, take dancing lessons like I do, or something. This is not hard.
No.
You know what I mean? And yet, about half the country is pre-diabetic, isn't it?
Yes.
It's a world national epidemic.
It is. It's national. There are some genetic predisposition.
Yeah. Oh yeah. a
Also
few.
in certain countries like India has
Yeah.
very high rate of diabetes.
Yeah.
Yes.
And I like Saudi Arabia, 90% are pre-diabetic.
Oh my God. They have the
Yeah.
world largest bariatric surgery center there.
Do they really?
Yes.
Yeah, is that right?
Yes.
Yeah. And talk about surgery a minute while you brought the
Yeah.
subject up. I mean, some people need surgery, and it's done people some good. Do you send a lot of patients for that, or occasionally, or?
Yeah. Good question. My view about surgery, bariatric surgery, nowadays they call it metabolic surgery. It's actually very effective way of lowering the set point. You know, a lot
Yeah.
of ways you can lower the set point, means you lose weight.
Yeah.
Bariatric surgery is one of the best way.
Does it quickly?
Right. It does it. In fact, Cleveland Clinic has studies for diabetic people with obesity. After bariatric surgery, they had remission of diabetes. They have to take off all the medicine.
Yeah, pretty quick.
Right. But surgery will work, in my opinion. I'm not a surgeon.
Yeah.
I'm a non-surgical medical bariatrician. That anybody who needs surgery, if they go through non-surgical medical treatment, they're going to learn a lot about their body,
Yeah.
their metabolism,
Yeah.
what worked for them, what didn't work for them. So with that background, about 6 to 10 months of trial of losing weight. After that, if they still want to lose more than 10%
Yeah.
weight loss, yes, that person could be a candidate for
Yeah.
bariatric surgery.
Yeah. And we in the city here, we have really one of the experts at doing it. I think he's Staples. most of them. But that shouldn't be the first choice, because after all, you're not going to absorb all the vitamins and all those things. They take supplements, and I've seen a significant number of people that gain their weight back too. But it has definite value. I've seen some great results, and so it's something that, you know, that's on the list. Tell us a little bit more about the proteins that you could eat, like tofu and some of these proteins we get from soybeans, really, right?
Right.
But they're can be healthy for you.
Very healthy.
I read more about protein from vegetables now, and they are developing systems to make it taste like meat. Have you run across that at all?
Yep, I read
You
about
feel like
that.
you're eating bacon when in reality it's a vegetable.
Right.
Probably pretty good, huh?
I think for certain people it could be a good choice. My focus is actually people who has obesity. For them, we really need to focus on a specific amount of carbohydrate, and a specific amount of protein and multivitamins, vitamin D, fish oil, those kind of things. So once they lose weight, then we can reintroduce some of those food that they like to eat, a smaller amount. The portion control is really, really important. People cannot do low carbohydrate diet too long. They become bored with that. So they have to introduce the fresh green vegetable is wonderful. In that regard, I'm going to say it is not the amount of food makes us fat. It is the type of food makes us fat.
Absolutely. They used to think calories in, calories out determines it. No, it's a type of calories. Type of calories. Because if you eat high fiber foods like vegetables and fruit, they're fiber. You're a lot of it's going to leave in your stool. But if you're eating mainly fatty food, 96% will sit in your belly in about 4 hours. If you're drinking oils, they're saying 4 minutes. So it's that type of food really runs it. But you know, some people are hard to interview. So I read in your PowerPoint about motivational interviewing. Tell us about that a little bit.
That's interesting. You know, I have been family medicine since 1995. Medical school really didn't teach you that. To motivate people to change their behavior is a kind of like art. It's a technique. So I learned it during my certification exam about 7-10 years ago. But then you have to practice every day in the office. There's somebody, I'll give an example, like say somebody smokes. We can say non-compliant. It's easy to say that, but our goal as a provider is to bring them in from pre-contemplation stage when they're not ready to contemplation, maybe action stage, and then help them to quit smoking. So every single day, you don't want to dictate anything. You want to say, for example, somebody is coming to see me for cough, I'll treat the cough and they have obesity. I'm going to say, if you want to talk about that, just make another appointment. And they don't get that from regular doc because regular docs are busy, right? So I'll bring them in and discuss the obesity next visit if they're interested. It has to come from them. That is one way. Don't become any judgmental, and then help them to go from contemplation state, action state, then they're successful and maintain it. So it's kind of a technique. I think medical schools start to pick that up, and not only in medical medicine, I think in many businesses they have to have that for the customer care.
It's very interesting. When I was a neurosurgeon for 44 years, I read a lot of books and I saw a lot of patients who were come to see me with a backache, when in reality I thought the weight was more important because they had diabetes too, and I knew enough myself that I knew they could get rid of it. And I know a lot of them I spoke to in a way didn't appreciate it because their family doctor wasn't
motivated
bringing
to do
it up.
Anything. Yeah.
I was bringing it up, and I remember getting letters back, and they wanted the money back. And they would say, well, Dr. Kachmann got on the floor and showed me how to do push-ups, and he wanted me to look at my DVDs and read my books, and I came for back fusion. Oh, yeah. That happened to me. I wish I'd saved every one of those letters, but I think I was violating really the rule of motivational interviewing. But the point is, how we're going to solve it. The family doctor wasn't doing it. They were seeing me. You see the point? There was conflict. So I started writing, books about it.
I think it should be provider. It's an epidemic in our country.
Yeah.
We are going in wrong direction.
Yeah.
We are treating the disease,
Yeah.
which is very expensive,
Yeah.
and is suffering for the patient.
Yeah.
If we treat ahead of that, I would think all the providers, irrespective of physician, nurse practitioner, physical therapist, nutritionist, everybody should be helping these individuals to help to get healthy.
Yeah. I think we have a national epidemic.
Yes.
And I don't mind saying it even on television, because I've been to the medical school and I know the deans. They're not teaching it to the students.
No.
This should be mandatory for all the students, especially this one, because that would get rid of the majority of diseases that we're treating, probably save $1 trillion.
Yes.
And it's not just that. Is when a person doesn't do anything about this and they're denial and they're blind to it, they will probably live 20 years less. And I saw this in a book, is that they may have 30 to 35 years of disability. And I'm talking about serious disability. I was at a funeral recently where the gentleman, unfortunately, they had died, both legs amputated. Yeah. A brother had already one leg amputated. Mother died from diabetes. The lady giving the sermon was a sister. I think she had diabetes, didn't know it, blind and denial. So that's the reason I'm doing this, to teach people, and that's why it's a wonderful discussion. So I read in your paper too here about intensive weight loss program. You have that in
Yep. So
tell us about that a little bit.
Thank you for telling me. After many nights of studying and learning and discussing from the colleagues, I looked at my group of people and I wanted to give them a simple tool so they can follow. So I come up with 5 things you can do to get healthy and lose weight. Number 1 is water. We need to drink water. Because you're going to go from carbohydrate burning to fat burning mode. You may get dehydrated.
Yeah.
So you got to drink a lot of water.
5 glasses a day at least?
Good question. So I know this question will come. Some people say 8 glasses of water. I said, don't worry about counting glasses. Who counts it? I don't count it.
Yeah.
So take that multivitamin in the morning. Start drinking water. If you have enough water, in the evening, urine should be clear. If urine is yellow in night, that means you didn't have enough water. So water is so important, that's why I put number 1. Don't put me down on that one. You better drink water. Okay, so that's one.
So when a clear urine, if you urinate before you go to bed, it should be clear.
Yeah.
That's a good one. That's a good one.
That easier way, because then you're not throwing them, you have to count.
Yeah.
And water need is dependent on a lot of things. Your hair up, hair down, exercise, what you're wearing, ambient temperature, who knows?
Yeah.
So if you follow that, the multivitamin in the morning, you're getting the nutritional part done. After 2 hours, they will have that flush of vitamin B, but at the night, evening, it should be clear if they drink enough water. If it is dark in the evening time, that didn't. So you better drink water. Number 2, I'm going to tell them 2 grams of fish oil and vitamin D. There are some studies showing that fish oil is anti-inflammatory. It reduces the risk of heart disease. And vitamin D, people say it's a vitamin, it's actually a hormone. It takes care of the bone, muscle. It actually helps to burn the fat. So I'm going to make a habit of taking this vitamin D, the patient who has obesity.
How many units a day?
I will give them 2,000.
2,000.
Yeah. Now, if I do the test, if they're very low, which most of the time, then I have to give mega 50,000 units 2 times a week for 8 weeks and then once a week. So vitamin D is important on that. So what I'm doing is number one is water. Number two, I'm making them some habit. Number one, also I'm going to tell them you have to check your body weight every day.
Yeah.
If we don't monitor, we are bringing them in a behavioral change. And I'm going to tell them that buffer zone means yesterday you went to a party and ate a lot of food. Today you stood up in that little scale and you gained 3 pounds. You got to do something today.
I noticed that after I eat at a restaurant, say, you know, in the evening, sometimes up 2 or 3 pounds, and I wonder why. And I think a lot of these restaurants, a lot of salt.
Yes.
Because in a couple of days, that's usually gone.
Yes.
And I tell people too about weight. If you exercise a lot, which you know, I play pickleball, play tennis, and I'll play a long tennis match, 3 hours on occasion on a hot day. I'll get on a scale. I'm down 10 pounds. You know what that is? That's a fooler, because glycogen, a pound of glycogen is attached to 2 pounds of water.
Wow.
I've learned that. Yeah, 2 pounds of water. Yeah. So as you drink the water back to make your water clear, you'll notice that maybe you lost a pound, or half a pound. Oh yeah, I've had that happen more than once because I played some of these extreme matches. Isn't it interesting? So what's number 4?
Number 3 is 3 meals a day.
Yeah.
Count your calorie if you can, about 1200 calorie or less.
Yeah.
And number 4 is 4 palm serving of protein.
4
palm serving
day.
a day. Yep. So make it simple. You can say 1 palm serving 3 times a day. So
Okay.
30 grams 3 times a day. And the last one is carbohydrate. If it is white, it is really not right until 12 weeks.
Yeah.
So we say you have in the breakfast time 0 carbohydrate and 30 gram carbohydrate in the lunch, 30 gram carbohydrate in the supper time. In the morning, you don't eat any carbohydrate. The reason is body is waking up and asking you to give me the fuel. If you start the day with carbohydrate, you're going to bring in insulin. What insulin will do? You stop the fat burning.
Yeah.
So you take that opportunity in the morning. Don't eat any carbs, just eat protein.
Yeah.
It will keep you up all the way lunchtime without getting hungry.
Even
So those
oatmeal is out, huh?
Well,
Or-
oatmeal is fine for somebody who doesn't have obesity.
Yeah.
Right.
Yeah.
We are talking about people who has obesity.
Overweight.
Yes,
Yeah.
overweight.
Because you want to be in ketone metabolism.
Right.
I think it's a beautiful.
One
excellent-
other thing I teach them, the teaspoonful of sugar. Our teaspoonful of sugar has about 4 grams of carbohydrate. 1 teaspoonful. If you look at our blood sugar level,
Yeah.
80 to 120 milligram per deciliter, we have 5 liters of blood.
Yeah.
If you count the whole body, it's actually 1 teaspoonful of sugar.
Yeah.
If the blood sugar becomes 2 teaspoonful, it's diabetes. Then I'm going to tell them, let's count how to calculate teaspoonful of sugar in a food.
Yeah.
You take the total carb minus the fiber, divide by 5. So if you took a Pop-Tart, you'll find out that total carb minus fiber divided by 5 is going to be about 7 teaspoonful of sugar.
Good. Thanks very much. I think you've had a thorough explanation here today on how important weight loss can be. 70 diseases attached to it. And I think it's a combination of what I'm teaching, what you're teaching. We'll be working together at the Three Rivers Pharmacy because we feel it is extremely important. At the moment, we're doing it, frankly, for free, but eventually you'll probably have a full-time practice there. But that's our plan. Thanks so very much. Keep on following our public access TV shows. You'll gain a lot of information. Why are we both sitting here today? We care about you. We love you. Frankly, that's why we're here. Namaste. Namaste. Hope to see you again and see us other shows or at the Lutheran Hospital, free lectures, or the pharmacy for some consultation. And we will make you well. We will make you well. Turn on the music. Take up dancing.